Awesome. So we're live. Hi, everyone. Good day. And this is the HSB Market and Startup Spotlight series. And today, I'm pretty very excited to be spotlighting yet another founder who I would say is beyond phenomenal. I think when I got to meet Tobias, I was like, oh, this guy is actually building for health in the continent of Africa. There must be something in it. There must be something he must have seen. And so I'm pretty very excited to have this really, really amazing conversation with Tobias. So the Market and Startup Spotlight series, as you all know, is really where we spotlight some amazing builders of healthcare and also create the opportunity for people all over the world to learn about different healthcare markets, right? So you're in Australia, you're in UK, you're in maybe Germany, and you really don't want to understand how the market in China works. This is where you should be. Today, I'm going to be having a great chat with Tobias, and he's going to be sharing perspective of both his company, Vibeg Medical, and also his perspective of building for health in the continent of Africa. I'm excited because Tobias is not just built in one country. He has actually built in a couple of countries in the continent. So, ladies and gentlemen, without any further ado, give me the privilege of introducing to you Tobias Reiter. Hi, Tobias. How are you today?
Hi, everyone. Yeah, I'm good. Thank you very much for having me.
Awesome. So, can you tell us a little bit more about yourself? Who is Tobias? And basically, generally, why you chose to, build in health?
Sure, yeah. So I'm originally from Vienna. When I was in college, started my first venture when I was 19.
Wow.
It was an AI-powered trading platform. So back then there was a crypto hype, and there were even other assets with which you could do arbitrage trading. Not get into the details, but for those who are interested, can Google it. And yeah, and that's also how I got into technology. And we then even had a tech team and developed algorithms and software platform, right? Automated trading. And this was very exciting because I was still in college and had normal college life, and not everyone knew that I was making quite some decent money back then, not like millions and millions, but a very good amount. But after a few years, to be honest, it got boring. I didn't only want to make money, and wanted to do something more meaningful. And I got very interested in healthcare and in
Wow.
Africa, and had the opportunity to go to Rwanda for my master thesis.
Oh.
And yeah, I immediately fell in love with the country, with the
Mm.
region. Also got to visit Uganda, Congo. I thought, wow, here, I want to do something here. I see the potential. And met my Kenyan co-founder who worked in healthcare. By now he already exited, but he showed me this massive problem in healthcare, that
Mm.
hospitals are not data driven when it comes to procurement. And this is when then I thought, okay, wow, I can use my experience and my knowledge from my
Mm.
previous venture, even the capital, to create impact here and build a sustainable company on the continent.
Wow. Such an amazing story. So just from, typically we hear the story of people like, the Mark Zuckerberg, Bill Gates that dropped out of school and, they found an idea in college. And I mean, it's quite interesting to hear that you said something about building an AI solution as far back as 19 years old, when you were 19 years old. So it means that this trend we're seeing has existed for quite a long time. And I also love the fact that you mentioned, just the exposure you saw, for your exchange program, for your thesis, how it, made you realize that there is something much more than what I'm seeing in my country. I can bring best practices over to the continent. I think that exchange is very powerful. And I really love the fact that you spotlighted it. But I'm pretty. I always ask my guests this question. Every of my guests have to answer this question. So forgive me for putting you on the spotlight, but why healthcare? I mean, obviously, I'm sure when you came to Rwanda, I'm not sure, I might be wrong. Do you have a healthcare background? But I feel like I would love to know your why. Why did you choose to do something? Why not construction? Why not fintech? Why healthcare?
Yeah, no, so, as I mentioned, I previously worked in fintech, right? And for me, it was not enough meaning, not enough impact that I created
Mm-hmm.
with it. And healthcare is one of the most essential things you can offer as a company, right? Or you can work it as an entrepreneur.
Yeah.
And when my Kenyan co-founder told me this opportunity, he was working in healthcare, right? And I had no healthcare background.
Mm-hmm.
But I thought, wow, this is a great industry to work in. And when I, visited more and more clinics and healthcare providers in the region, I saw a huge potential,
Mm-hmm.
not only economically, right, as a business. Obviously, in Africa, with 1.3 billion people, right, you have massive market to tap into as a healthcare company, but also the opportunity to really make a difference.
Mm-hmm. Yeah, I think that's pretty very interesting to spotlight because sometimes people feel like I don't have a healthcare background. I really don't know anything about healthcare, and so I can't. The truth is, if you're really passionate about solving and saving lives, you will definitely find a reason to stay in healthcare. And I love the fact that you mentioned that you saw the opportunity and realized that there is a great opportunity to create an impact in this space. I thank you for doing a lot of the work you've done. I think even the ripple effect of your medical device company has probably, helped save a lot of lives. So thank you for spotlighting that. So yeah, I'm going to talk a little bit about, I would love for us to chat a little bit about Vibeg Medical, the company you started. I think I would love for you to tell us a little bit more about Vibeg and what you guys are doing, how because you scaled this company to not just one country, several countries. So let us know a little bit about what Vibeq Medical is about.
Yeah, so Vibeq, the name comes from La Vie in French, life.
Oh.
Brains engineering group. So we wanted to have a unique name. And, what we initially started with was demand forecasting. So we saw that hospitals bought and procured everything based on gut feeling, right? What kind of medical consumables do I need? What kind of medical equipment should I buy? And what health services should I offer in this clinic? Or even one step further, where should I put my clinic, right? All these decisions can be based on data. And obviously, with time now, in the past, 10 years, even especially in the last 3 years, there was a lot of advances that happened in terms of data quality, right? So digitization of healthcare facilities, even governments, countries, right? The whole
Yeah.
continent. So the more and more data that is available, the better the decisions that can be taken. And we initially started with inventory optimization, basically looking at historical data and forecasting the demand, how many gloves they need, how many syringes, and all kinds of consumables that a hospital needs. From there, we then offered financing. So buy now, pay later. And with that, we saw, hey, we can also offer equipment, right? So we then ventured more into equipment. And this is now a core focus because, it is such an important investment that a clinic, especially in a low resource context, right, has to make. Should I buy now a new X-ray machine? Should I buy a new ultrasound machine? What should I invest in? And this is what we're doing. So we're looking at the current disease burden in a specific area,
Yeah.
then forecast the disease burden. So how is that going to change over time based on certain, risk factors, right? How is alcohol consumption changing in the country? Consumption, city thing that can have an impact on diseases, right? Or is population changing, demographic data?
Yes.
And then with that, with the forecasted demand, and look at the availability of that health system of, certain equipment, right? So where is a dental department in this area? Is there a lack of oral health infrastructure? Is it ENT, right? And
Yeah.
so with that, you can even predict the profitability of an apartment or only an equipment, right? Basically help hospitals and healthcare providers become more profitable and governments and NGOs to create more impact, to better allocate their resources.
This is definitely a problem worth solving for, particularly in the continent of Africa, because I know, I'm from Nigeria, and I know that back then when COVID-19 pandemic hit the continent, globally, not just the continent, there was really that lack of clarity on existing equipment, existing capacity, existing supply chain. And so there was a lot of supply chain inefficiencies in the country, and not just the country, the continent in whole. I think this is definitely something that, would help galvanize and help you from a very top level to the bottom level understand what exists and how do you fill the gap, where are the opportunities and all of this stuff to create sustainable access to medical supplies and medical equipment. So great, great, great great problem you're solving for, and I'm really excited about what Vibeg Medical is doing. So yeah, you said you moved from just the data to procurement, and it to medical device in its own right. So now you supply hospitals and organizations with medical equipment.
And we do even more than that. So we're also
Mm,
looking for the right medical solutions. So, AI
mm,
solutions, for example, an AI powered ultrasound machine, right?
mm,
Because it is not only the procurement process that is an issue in healthcare, it is
mm,
also the delivery process, right? Often, how do you find, skilled healthcare staff in a specific
mm,
area? We do operate in South Sudan and in
mm.
the Eastern Congo, right? And
Yeah.
there are many areas in Africa, many regions, many countries where there's a lack of skilled
Mm,
professionals, right? And we believe that AI
yeah.
can increase the quality of healthcare services, right? We bring, for example, AI solutions for microscope that we integrate with our microscope so
Mm-hmm.
that you can get, a second opinion from AI on the diagnosis, right? For an ultrasound machine, even,
But
clinical decision making tools.
mhm,
So any kind of innovation that we can bring to our clients,
yeah.
I was gonna say to Africa, but we try to bring it from Africa to Africa. So
Mm,
there are different, solutions, right? From,
mm,
for example, Morocco, South Africa, Nigeria, Kenya, even Rwanda, right?
mhm,
Really trying to help these health tech startups, first of all, from Africa to get access to these other markets, but then
mhm,
even, from anywhere in the world,
yeah.
whatever is the best solution for the local context, this
Mm.
is what we want to provide. Not only the equipment, but also the, software.
Wow, that's pretty incredible. I love two things you said. You said something about, the system. You observe the system, you observe the gaps, things like lack of infrastructure, lack of capacity, like healthcare workers. And this is what beyond just the procurement, this is what Vibeg Medical is trying to solve for by just even observing, okay, we already have this, we use microscopes every day, we use ultrascan machine, but beyond just buying this equipment and dispensing them to hospitals and facilities, how do we put up an add-on layer that would even address this infrastructure and systemic barrier? So thank you for doing that. But you also said something that I really, really, I'm smiling here. I'm like, okay, from Africa to Africa. I would love for you to unpack that a little bit because, obviously, you are not, you are African by building, but how would you say your perspective about that concept you just mentioned from Africa to Africans? How do you tell the story now to the audience?
Right, no, I'd love to talk about that. I mean, yes, I'm not African myself. I'm African
Yes.
in my heart, right? I've
Yes, you
always had
are.
a lot of African friends, from a very early age, and this is why I
Yeah.
always was very interested in Africa. But yeah, so I think, Africa has so much talent, right?
Mhm.
It no longer needs to buy things that have been developed abroad, right? Now has a lot of, smart entrepreneurs that are building amazing, solutions for their local context, right? Their local country. They understand it better than anyone else.
Mm,
And what I see, what is still a bit of a problem in Africa is that Africa is so big, so many different countries and different cultures, right?
yeah.
So basically scaling from, Northern Africa, let's say Morocco, one of our partners, right, to now, West Africa, East Africa, right?
Mhm.
It's still a bit of a challenge, right? Different languages,
Yeah.
different cultures. And so we want to bridge that gap. We want to
Mhm.
be part of the whole ecosystem and, work with other African health tech companies and together build an innovative,
Mhm.
reliable
Yeah.
and strong health system that we can provide anywhere in Africa.
Nice. I really love that. I love the fact that you mentioned, the need for us to begin to think about home based and homegrown ideas and innovations. I think just this morning I was thinking about it. I was like, okay, I can't think of one global AI powered solution that, was developed by an African. I actually, it made me rack my brain a little bit. Like he actually exporting and importing a lot of, great ideas, $1 billion multi-dollar, ideas from the globe. And we really need to create that culture where everyone begins to think about not just building for Africa, but building from the globe for the globe. And I think that mindset is what we need in the continent right now. I think I was actually wondering, like I was asking myself, how many health tech companies in Africa are actually exported to the globe, but we have a lot of foreign-based healthcare organizations that are actually local. So I would love for you to talk about that local context and us building for not just local, but also thinking about building for the globe, right? So how do you think Africa can get to that point where we begin to build for not just local, but for the globe?
Hey, yeah, so this is the only thing that I did not mention, but was actually thinking like as a next step, right? When you, first of all, you're building for your local market, right? Then
Mhm.
you're building hopefully for the continent and then for the whole world. Because there are amazing technologies that are coming out of Africa, right? Or that have been piloted in Africa.
Yes.
Think of mobile money, right? That now, scale to other, or like is available in other continents as well, right? But
Yeah.
maybe not necessarily as, Safaricom, right?
Mhm.
But there are now startups that can, I believe, to other continents. And even we are now
Yes.
looking at Haiti. There are different, countries and markets that have some similarities, right, with certain African markets.
Yeah.
And yeah, I think first of all, as I mentioned, you have to really focus on one market and really
Mm.
understand the problem
Really
that you're
concepts.
solving, right?
Yes.
And really building this very strong foundation before you scale to other countries.
Yeah.
And then, when you are in multiple countries, if there are markets, I just came back from Brazil, which is
Mm-hmm.
obviously a very, very big market.
Yeah.
If there are markets that are somehow similar, not saying Brazil necessarily, maybe to South Africa, Brazil is a bit, quite advanced.
Mm.
As I mentioned, Haiti might be somehow similar to,
Yeah.
Congo, right? Like currently a bit of a challenging environment, but a lot of potential, right? So yeah, I think in Africa you have a lot of talent, so you can build on that. Can build a
Yeah.
very good team that can then, offer a service also abroad. And often
Mm-hmm.
this can be at a lower cost, right, than the
Yeah.
companies abroad offering it. If you're thinking about the US, we're actually working on a very interesting project with a very large billion-dollar company from Africa,
Mm-hmm.
from Zimbabwe, Southern Africa,
Yeah.
that now wants to expand to the US market, to provide
Mm.
telehealth services. Why? Because they can train people in Africa to reach the same level, right, as even in the US, and provide online services at a much lower cost. So I think the time of Africa is coming. It is now, you can say, but actually in the future, with all the population growth, rise of AI, I think there's a big future.
Mm. Wow, that's to everyone listening who is interested and has been asking themselves, do I go to Africa? Do I scale to Africa? Or perhaps you're a builder for healthcare in another part of the world and you're looking to expand into the African market. There is an opportunity, right, Tobias, right?
Right,
There
for
is
sure.
there is definitely an opportunity for you. The continent, you just need to, find that opportunity and, find the right people to work with to support your skill. But Tobias, I would love for you to just also help us spotlight why you choose Rwanda. Because oftentimes a lot of people are looking to come into the continent and they're like, oh, there are a lot of issues, there's security, there's infrastructure. And you did mention that you came there for your master thesis and you love the environment. But beyond that, why? I know you started your company in Rwanda. So why did you choose to start building for Rwanda? Can you tell us a little bit about the healthcare markets in Rwanda and all? Yes.
Yeah, I mean, I mentioned I kind of came to Rwanda almost by accident, right? Or I mean, when I had the opportunity to write my master thesis, in a foreign country, about a foreign country, about entrepreneurship in one of the
Mm,
upcoming economies. I was looking at either Africa, Latin America, and then I did a lot of research on Rwanda, where I had this
mm,
opportunity, right? And I saw how intentionally they have built, right? How strategically they have built a tech industry, and what I have seen, and almost spent 8 years in Rwanda, is that in terms of healthcare, it is the most intentional health system, right?
Mm.
There's a very strong planning happening. There's always also a lot of international support because, a lot of the innovators and even donors want a structured country that embraces technology and is open to innovation. So that there has been a lot of support and also very good, I think, finance locally from what I can see, and also support. So even the Rwandan Innovation Fund, is like a startup fund together with the, African Development Bank. So that was like the first, state startup fund. It's a great, thing to have if you're building a startup locally. It's
Mm.
Norskin, maybe you've heard of that. It's,
Yeah.
also a startup house, and Norskin is, by a unicorn founder from then. There are a lot of tech people investing in Rwanda right now.
Mm.
But the most important thing I think is it has become a great proof of concept market, right?
Mm.
If you're thinking of drone delivery, Zipline, right? The drone company, Babylon Health, right? A UK startup for telehealth. So a lot of startups, they see, hey, if I want to go to Africa and I want to have a good, proof of concept, I can start in Rwanda and then expand to other countries. I didn't really know it to this extent. I knew that there was an ecosystem, and also actually when I started Vibeg in 2018, kind of ecosystem was developing, right?
Yeah.
Everything I just mentioned happened in like 2020, 2021. The past, 7 years, there has been a really big, big, big
Absolutely.
development. So to some extent, we were lucky there, but also even before, there was already this path towards this kind of tech embracing, nation.
Mhm.
And yeah, I want to give one more example that even the Ministry of Health is building a sandbox. So, just for example, we could build our health demand simulation model and received, 9 years of public health data. They supported us with the data. They supported us with the funding. They supported us with experts that worked with us, right? And yeah, it has been a very, very good place to basically start, but obviously it is a small market. So
Mhm.
then, you have to really think carefully, where do you scale
Mhm.
from there? Because it is so structured, right? It's very different from other countries. I mean, if I
Yeah.
can say Nigeria, right? It's a huge country, very different, right? Maybe not as structured always, right? So you
Yeah.
will encounter some challenges that you have not faced when you worked in Rwanda.
Oh, that's pretty. I love that. I've been to Rwanda, and I can tell I was in Rwanda as far back as 2019. As far back as then, Rwanda was really, really doing well. I remember I had to work on a project where I was tasked on that project with the Rwanda Biomedical Center was really to think about an innovation to improve, data collection for, vaccines it was it was 97%. It was that good, but they wanted to get to 100%. And so they needed that a country is looking to get to perfect 100%. And definitely Rwanda is definitely a great country. You did mention something that I really want us to unpack a little bit. I really am enjoying this conversation and how it's going, which is the proof of concept. A lot of people say we have a lot of beautiful pilots in Africa, and getting to scale is kind of like a hurdle for a lot of healthcare entrepreneurs who are in Africa. So you've done this really well because I think you've been able to scale your business from Vibeg Medical from just Rwanda to different countries. I would love for you to unpack that will I call it a myth or will I call it a reality? What's your take on that?
So when we worked in Rwanda, we saw that there was a huge demand, a lot of customers coming from Congo all the way to Rwanda to basically buy quality products and from Burundi, I can talk about both countries at the same time because there is a huge black market, right? Counterfeit products, expired products that are flooding a lot of African countries that are not as strict as Rwanda when it comes to the importation of medical products and pharmaceuticals. So we saw, hey, that there is a big demand for equipment quality products in
Mm-hmm.
these countries. And we then, slowly started to do more marketing in these countries, went to spend quite some time in Burundi and Congo. I mean, for me, this was an amazing adventure, right? Very exciting and beautiful for those of you who have been to Lake Kivu and, then in terms of business, we started to see some issues when COVID hit and all the borders were closed, right? And we could no longer export to these countries. So we had to open a local entity. And this is what we did in 2021. So that was, quite challenging. For those of you who know, in Eastern Congo, there's civil unrest because situation was not always very clear. I see huge potential in Congo, especially for healthcare. With the, situation, which is quite complex, was back then at least, very hard to kind of scale and work also in Kinshasa and other places. So we kind of focused on the Eastern Congo with a local team on the ground. Then in Burundi, with a local team on the ground. I think it is important to some extent if you can choose countries that are closer to your headquarter, because it's just easier, to send employees back and forth for training. If we had then expanded to Nigeria and had to fly a Nigerian biomedical engineer all the way to Kigali, it would cost more money. It would be, it would take longer, right? And then the person might not speak languages, right? I mean, in East Africa, many people speak Swahili. It's easier to communicate. And if official language is English and French, and people don't always speak the same, right? So all these kinds of challenges. But and then we saw, okay, we are ready to scale, and we raised more funding, and we then expanded to Kenya, which is a very, very different market, very competitive.
Wow.
And be very honest, we expanded maybe at the time when the economy unfortunately took a hit, right? During COVID, after COVID, things have been a bit bad. Then now it's improving a bit, right? But that's the biggest challenge, to be honest, for me as a foreigner working in, East Africa, that the political relations between countries are always changing, right? The economic situations of countries are always changing. One time Tanzania is the best country, the next time Uganda, then it's Kenya, then it's Rwanda again, then Congo, changing. And if you're not an asset-light company, like with us, we have to deploy biomedical engineers, we have to have a warehouse, we have to have local teams, right? These are then very important decisions, right? Where do you invest your money? And if anything then changes, it's a challenge overall.
Oh my God. You actually have unpacked a lot for me here, and I really love it. I think I need to come to you for a class on scaling 101. Scaling 101, because trust me, you didn't just do this in one country, you've done this in like 4 different countries. I think there's a lot of lessons we should learn from you in just, taking the challenge, holding it by the hem. I mean, going to DRC to launch a business is definitely in this time. When you were talking, what just came to my mind was the pestle framework, right? We taught in business school, the political, economic, social, everything, all those factors that you can extract. They call it the extrinsic factors, and you've been able to deal with this, because oftentimes people feel like, oh, I have a startup, I'm going to launch. They think I'm going to launch in Africa. They think Africa is just one country, but you've made it clear that the realities are real, the cultural barriers, the language, the people, the talent, the energy, the political climate is going to be very different across this country. And this is part of why we have this podcast, so I kind of spotlight and make people know and realize, okay, this is what is unique in this market. This is what the private sector looks like. This is what the public sector, these are what the government have put in place to encourage innovation in healthcare and making sure that the healthcare business leaders are equipped and able to do this. So great. I need to come for a class with you. So when do I sign up for my class? This is really fantastic. Like, that's ability to scale a viable business model you've observed in one country and doing this in different countries is not, especially in Africa, is not easy. And I must give you your flowers. I think you're a phenomenal entrepreneur. Definitely, you've been doing this for a long time, and you've learned your lessons. So you said since 19, right? Since you were 19, you've been an entrepreneur.
Thank you. Yeah, 19. I can tell all of you it is much harder than it looks, and not always
Absolutely.
as shiny as it looks. I mean, I know from many, fellow entrepreneurs that
Yeah.
often we wish we had been employees.
Truly.
This
Actually.
is one thing I wanna say to anyone here who is,
Yeah.
an aspiring entrepreneur. So obviously, think it is the most beautiful thing if you can fulfill your dreams and do
Mm,
what you're passionate about and
yeah.
build a meaningful company. But if I had to do it all over again, I would first work for around 1 year, maybe 2 years in the same industry that I want to work in, or that what I want to do a startup in
Mhm.
the same country ideally.
Right.
If I'm a foreigner, even if I'm a Nigerian and wanna do something in East Africa, right, I would go to, Kenya or wherever in Africa,
Yeah.
and really, learn on the ground what the
Experience.
problem is. With a decent salary, you don't have the same pressure, right?
Mm,
You can really learn from other companies how they're doing it, and
yeah.
then you can do your, startup. But I just moved to Rwanda with, funding that I had from my first startup and just started. And it was very,
Same
very
here.
stressful because I didn't really understand the problem as much as I do now, right? And I did not yet have the network,
Mhm.
not yet even like have the social circle, right? Sometimes as an entrepreneur, you need to have the right
Great.
friends, right? The right support if you come.
Yeah.
You go to a foreign country and you go all in there
Yeah.
with all your money and something doesn't work out, it is a tough and lonely situation to be in.
Yeah. In the words of Elon Musk, trying to start building companies like chewing glass and looking to the abyss.
Right.
So definitely, I really want to commend you because I mean, I'm very impressed about, just the fact that you took the helm and you just came for an opportunity and you saw a gap and you decided to launch into and definitely no one is saying it's been easy, but you've saved a lot of lives just with the medical equipment you've been delivering in the continent. And I want to say a very big shout out to all founders, everyone who is building right now. Definitely, the journey of an entrepreneur is it's not an easy one. It's definitely not an easy one. And, definitely all you said is very important. Having the right cycle, having the right network to really make things easy for you. But you don't build that in a day. You actually have to keep doing what you're doing. And, almost all the founders I've had on the market and started Spotlight Series always tell me that they wish they never started a company, but they also are fulfilled. And I'm like, okay, which one? Choose one. Choose your bottom. Are you fulfilled or you wish, or it's most like we already started it, so we're gonna stay here. I think we all need to really appreciate anyone who is building. I know sometimes we can choose to want to backlash and tell them, oh, you're not doing well, but everyone who is building has a level of pain that they're bearing in them, personal sacrifices and all. I really can't tell what Tobias has been through, but obviously I know he's been through quite some, especially the fact that he scaled to 4 countries and, even just the thought of managing operations in 4 different countries is a lot. So please, everyone in Vibeg Medical, say big thank you to your CEO who is doing amazing work. I know that he probably has led you in different ways, but definitely building a foundational company that's saving lives in different countries is no small feat. So I want to say a big kudos to you, Tobias, for all you've done. Please don't stop.
Thank you. But you need always the team. So without my team, I could never ever have done this.
Yeah,
And I'm very happy
absolutely.
that I have African team, right? We actually almost all of us I mean, all the other ones are Africans, and it's been amazing to work with Africans. So
Yeah.
anyone from, Cameroon to Congo to Kenya to, Rwanda, Burundi. So yeah, you always, as an entrepreneur, need your team, and this is our
Definitely.
company, not mine. And yeah, very grateful that I had the opportunity and all the support from the whole ecosystem also.
Yeah, thank you for saying that. I think your team, if they get to hear this, will be very excited because, obviously, almost all the partners also say the same thing, finding the right team, the right support people to help you, scale the vision you have as a founder is very important. And, doing anything great, you need the right people around you. And we need to say big thank you to all the team at Vibeg Medical who have supported this vision. And, I want you to see beyond what you're doing to actually the lives you've touched and the lives you're saving. So thank you so much. This has been really fantastic. I love the way the conversation has flowed across, what you're doing to the African market and, finding product market fit the challenges. I want to talk a little bit about collaboration and partnership, because obviously, I worked for a couple of years, in Africa in private sector, public sector partnerships. And I know that there can be some sort of sync between the collaboration between private sector and the government. So how would you say you love things to look like, right? For entrepreneurs who are building for healthcare in the continent, what would be the ideal that you would love to see, you know, given all the challenges you faced so far in scaling your business?
To understand what I would love to see when it comes to public-private partnerships, or in general, like what kind of solutions?
Yeah. So what would you like to see? Like, would you like to see more collaboration between the government partners and your private sector entities? Yeah.
I know, I think in healthcare, right, the public sector plays a huge role,
Hmm.
and it is very, very important for any health tech startup in Africa to work with the public sector. And it is important that the public sector also has the resources, even to, the talent, right? That the people that understand the value of technology in healthcare.
Yes.
Um, and, the right plans, right? All the way from the vision to the execution. We've seen that in Rwanda and so other countries in East Africa is the case, right? But we've also seen it we've operated in countries where unfortunately, the public sector or the government is not yet as collaborative.
Mm,
And I think it is extremely important that every country in Africa, every government has this kind of sandbox, right? Where
mm,
they're working with local innovators,
yes.
amazing entrepreneurs, talented people in Burundi, Malawi, in many countries in Africa where there is not yet this kind of startup ecosystem, right? Not as many investors and so on. And, for them to really scale, they need the support of the government. They
Yes.
need the sandbox where they can work with real data on the ground, can get a proof of concept, even if they're working in a small country, right? And then with that proof of concept, expand to bigger markets in Africa.
Mm,
Ideally, governments, embrace their health ecosystem, build it together to help, a company from West Africa to scale to East Africa. It really adds value to the local
mm.
ecosystem rather than, as you said, buying it from abroad, right?
Yes, absolutely. And I think that's what the African Free Trade AFTA is trying to accomplish, and I hope that that comes true, because I think that really aid things a lot more. Definitely, I love the fact that that collaboration, we need to get to that point, and even beyond just the government's private sector, even within the private sector, we need to come together and actually see how can we support the ecosystem better. How do we make things easier for patients in our population? So thank you so much for unpacking that. So like we've really, really talked about your company and Vibeg. I want you to talk to founders right now. I know you said a little bit, but people who are currently building for healthcare, what would you say to them if someone is very interested in doing something right now in healthcare? What would be the opportunities? What would be the advice you have for them in terms of building?
Yeah, I would tell them to go to local events. So, for
Mhm.
example, there's the Africa Health Tech Forum, right? There are all kinds of health tech hubs and conferences, and really talk to local implementers, so local clinics, local governments, NGOs, to figure out what they need. And I think right now with AI, ChatGPT, Claude, they're very good. I call them sparring partners, right? Where you can really
Mhm.
talk about ideas, work on a few different ideas and go to the market and hear from people if they really need this, right? And
Yeah.
obviously, there are huge issues when it comes to supply chain that can still be solved, right? Supply chain in general can always become more efficient, even in Europe, America, anywhere, right? So, supply chain, health service delivery, right? How can AI replace or augment certain process in healthcare,
Yeah.
right? And general decision making, right? Public health tools for governments to better monitor their data, their health systems, or take action based on the data. Those are a few things to look at, I think. And what is the most important thing is to find the right co-founders and have a few partners with which you can, I mean, local customers with which you can do a pilot, right? Get a proof of concept. With that, you can raise funding from business angels. Ideally, then work with a local government on really scaling it nationally, get more funding to scale it to other countries. And then hopefully, whoever is listening, you'll be the, expanding it to other continents.
Mhm. Absolutely. Wow. Thank you. This, what all you just said in 2 minutes is a lot to unpack. And I think me, me myself, I'm gonna listen to it again. I just kind of like highlight everything you said. But that's like the playbook of launching a business in Africa. But thank you so much. This has been a really, really great conversation in terms of like just understanding what you're doing and also the market and your interest in the market and also building for health and what you've done as a founder. Yeah, so I always end of my podcast with this question, and I want to ask you that question. I'm sure there are days when you wake up and like you said, I wish I easier to be a employee. I don't want to do this anymore. But what's that quote? What's that? Could be a principle, could be a quote that keeps you going every time you think about it, and you just keep going for it.
Yeah. So what I have, always in my mind whenever I face some challenges is, this one quote, right? And this is the way I live my life, by which I live my life. And it's called "The purpose of life is a life full of purpose." So I think, when you're building something or even when you're working for someone, right, whatever you're doing with your life, with your time, you have to find purpose in it, right? To serve others somehow, to add value. Because as I mentioned, I've worked before in an industry where you're just playing around with numbers and trying to make money, and there is no purpose. There's nothing you help,
Yeah.
with arbitrage really. And there are all kinds of theories that people tell themselves, well, in finance, how they're adding value in general can be very purposeful, right? You need to also provide capital.
Yeah.
There are jobs that add more purpose, I think, or that have more purpose and add more impact and meaning to life than others. And I myself have seen that when I have the feeling that I'm adding value to our world, I feel more energized, I feel more fulfilled, and I'm just happier.
Absolutely. I think it's a very simple quote, but actually has a lot of meaning. It's a life full of purpose. So when you're feeling down, isn't it? It's a life full of purpose. You, I think that can keep you refueled and strengthened. So thank you so much, Tobias, for sharing that with us. And I'm sure you're definitely living that life because obviously 1,100, over 1,000 healthcare facilities have benefited from your business already. You're already still doing more in terms of layering data and AI and all in the continent. So great, 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 great. I'm really glad to meet you and learn more about what you have done in Rwanda and 4 other countries in the continent. So thank you for this opportunity to learn from you and what you have built in Rwanda and beyond Rwanda. Vibeg Medical is here. So how do people get to meet you? If people are wanting to reach with you, how can people support? What kind of partnerships and support are you looking for if anyone is interested in partnering with you?
Yeah, we're always looking for people, for companies to work with and together to make quality healthcare more affordable and accessible in Africa. And if you're interested, you can check us out online. So www.vibeg.com. You can look us up on LinkedIn and get in touch with us, even with me, Tobias Reiter on LinkedIn. Happy to talk to anyone who is passionate about healthcare and making Africa an even better place.
Thank you so much, Tobias. Everyone, you can reach Tobias on LinkedIn, social media, and his company, Vibeq Medical. You can find them online, visit their website, learn more about what they're doing, see how you can collaborate. We talk about collaboration because that's the fastest ways to scale and improve, our healthcare system. So thank you so much, Tobias, for sharing that. Thank you, everyone. This has been a really fantastic conversation on the Market and Startup Spotlight series. And today I am sitting with a founder I've sat down with a founder who has been an entrepreneur since 19. He has built successful businesses, exited businesses, and even right now, he's really solving for healthcare on the continent of Africa, successfully scaled to 4 countries. I think we should give him his flowers because that's a big feat. Healthcare is one thing that is really, really hard to scale in the continent, but he's done this successfully. And I really want to commend all the team at Vibeg Medical for what you're doing in helping to save lives in the continent of Africa. So once again, this is the HSB Market and Startup Spotlight series, and today's Tobias. Reach out to him and connect. Thank you everyone for listening, and stay connected. Health is a serious business and we are in the business of saving lives. Thank you everyone, and do have a great rest of your weekend. Bye.